Assalamualaikum. Today I am here to present the topic which is related to gene therapy. First of all, we have to know that what is gene therapy. Basically, gene therapy is introduction of normal gene into cells in place of missing or defective one in order to correct genetic disorder. In this video, we see the animation of gene therapy.
Sedna can be formulated to use multiple routes of delivery, including lipid nanoparticles, polymers, and novel fusion particles. Sedna avoids the pre-existing immunity that prevents many patients from receiving viral gene therapy, as well as the acquired immunity that has prevented redosing of viral gene therapy up to now. Sedna's unique structural features allow it to translocate from the cytoplasm to the nucleus without viral capsid. Once in the nucleus, Sedna forms stable, non-integrating episomes with durable long-term expression.
And now, we discuss the types of gene therapy. There are basically two types of gene therapy. One is somatic cell gene therapy and next is germline gene therapy. And now, what is somatic cell gene therapy? In somatic cell gene therapy, therapeutic gene introduced in somatic cells. And next, what is germline gene therapy? In germline gene therapy, therapeutic cells introduced in gene therapy. In this slide, we see the procedure. How gene introduced in somatic cell? First of all, we isolate the stem cell from bone marrow. After isolation, we introduce vector gene in bone marrow cell, then grow these stem cell with therapeutic gene in culture, and then verify the expression. After getting satisfactory response from expression of therapeutic gene in stem cell, transgene it into patient body. Next, germline gene therapy. In this slide, we see the procedure. How therapeutic gene introduced in germ cell. First of all, we see on the one side of slide, the patient couple have mutant zygote if it grow further. Ultimately leads to death of baby. Now treat it by gene therapy. Firstly, we isolate zygote with mutant gene and place it in culture media. After that, we introduce the therapeutic gene in it. Allow it to grow the isolate one genetically modified cell from culture and introduce it in inoculated egg cell, then place it in mother body.
Moving forward, we discuss the types of somatic cell gene therapy. There are majorly two types of somatic cell gene therapy. One is in vivo gene therapy and other is ex vivo gene therapy. In vivo gene therapy, gene introduced in stem cell inside the body. It is less invasive, technically simple, and vectors are introduced directly. However, safety checks is not possible and there is decreased control over a target material. In ex vivo gene therapy, therapeutic gene introduced in the stem cell outside the body. It is technically complex and no vector introduced directly into the body. In ex vivo gene therapy, safety checks possible and there is close control. Moving to it further, we discuss the advantages as well as disadvantages of gene therapy. Firstly, we discuss the advantages of gene therapy, which includes it gives chance of normal life to baby who born with genetic disease, give hope to the healthy life to the cancer patient. For certain disease which have no cure other than gene therapy, it could save many lives. Everything has advantages as well as disadvantages. The disadvantages of gene therapy includes genetic testing, screening and research on availability of certain gene is very controversial. Increase the rate of abortion if parental test regarding baby with genetic disease is done. The cost is very high and the patient might use insurance to cover the treatment. Cosmetic industries may monopolize the gene therapy if issued in enhancing beauty and in vanishing the aging effect. rather than used for the treatment of disease. Thank you so much for your concentration listening, and I hope you will enjoy this video.